Hello, my name is Marcus White, and my presentation project is substance abuse in older adults, or addiction issues. I picked the topic of substance abuse because there are a lot of varying factors that go into substance abuse, especially with the elderly or with older adults. It's normally glossed over and not really explained or talked about much. And also there are many different factors for why the elderly or why the older population would be more susceptible or vulnerable to drug addiction or substance abuse. So that is why I picked that topic as my narrow focus, and I'm going to present that here. The first portion of my presentation I would like to talk about is just a little bit of background in terms of who is most susceptible and who is considered the older generation. So the older generation that I'm talking about specifically is the baby boom generation, the one directly after World War II that are now turning into their 60s. Many of them are retiring, they're coming out of work life, they've either lost loved ones, or they have a different way of thinking nowadays, or they have different things going on in their life, and that makes them extremely vulnerable and susceptible to drug addiction and drug abuse because the varying factors, the varying different things in their life that can go wrong or can happen makes it very easy to fall into these patterns of abuse. Many had been drinking for a long time. Some of them need pain pills for chronic diseases, and they end up becoming addicted to those as well. The support structure might not be there, whether they're in a nursing home or they're not, or they are having a hard time because they lost loved ones, or their family's not really just there for them. Just to give a little bit of statistics, they comprise of 30% of the total U.S. population, so it's a huge population of the United States. 30% may not seem like a lot, but when you look at the fact that there's 300 million people in the United States, that's quite a hefty amount of people. The size of their generation and the longer life expectancies has made the U.S. Census Bureau project the number of adults, older adults, will increase from 40.3 million to 72.1 million between 2010 and 2030. And these are staggering numbers because that shows that the population is growing older very quickly, and it's becoming more and more of a factor that they're going to be needed to be taken care of. So the baby boom generation is who I specifically focused on, and it seems that although statistically younger generations are still more susceptible to drug addiction, the older generation is just as susceptible because of the vulnerabilities that I discussed earlier. So let's talk about drug abuse or addiction, and let's talk about what happens to the body when one becomes addicted to a drug. So drug addiction comes on clinically as needing a drug, compulsively taking a drug, and it may start off as recreational, it may start off as just trying it out socially, it may start off as prescription, but over time the dependency starts to happen because the person takes the drug, whether it's alcohol, tobacco, illicit drugs, prescription painkillers, and they feel a sense of euphoria from dopamine release in the brain. The same pleasure centers that happen when you eat or have sex activate when you take drugs, and so when they take these drugs they feel good, obviously, and so they continue to take it, and they continue to take it and continue to take it, and then after a while the body becomes physically dependent, the mind becomes physically dependent. Many professionals and experts think of it as a multi-stage process. So the first stage, and I'm going to quote here from an article that I found. I'm going to quote, in the first stage, the individual's occasional drug taking becomes increasingly chronic and uncontrolled. The neurological source of these symptoms is drug-induced deregulation of the brain's reward system. Normally, increased dopamine signaling within the system, specifically in the ventral striatum or nucleus accumbens, produces pleasurable feelings that orient organisms to seek and perform life-sustaining conditions and activities, such as locating supportive environments, eating, and having sex. Drugs of abuse hyperactivate the system, triggering abrupt and large increases in NA's dopamine signaling, producing intense sensation that motivate additional drug taking, and promoting the formation of maladaptive drug-stimulus association. So basically, to break that down into layman's terms, is that the user continues to take the drug, and the body is physically becoming dependent on it because it thinks it's an actual life need. It thinks that it's something like food or sex or something that the body needs to sustain life. So that's why it becomes dependent. Now, in the second stage, the addictive process presents other types of problems. Withdrawal symptoms. Many people have heard of this. Everybody hears of the classic, like somebody is addicted to heroin and they're trying to get off it, and they see, in movies or whatever, in books and TV shows, that they're in pain, or they're having like night sweats or night terrors and things like that nature, and they can't get off the drug. Which this happens in the process of early abstinence. That's why we have methadone clinics for those that are addicted to heroin and stuff of that nature. There's a huge vulnerability to relapse and alterations in decision making. Many people fall into criminal activity because their brain needs this drug, their body needs this drug, so they're gonna find a way to get it no matter what. We hear it all the time. Pharmacies getting robbed, so that way they can get their fix. And it's extremely complex, and the second stage of addiction is not really well known completely, and I quote, "The full extent of drugs' impacts on cognition is not yet known, but research indicates that addicted individuals have alterations in brain regions including the striatum, prefrontal cortex, amygdala, and hippocampus. These same regions underlie declarative memory, the memories that define an individual or self." So they do kind of see that this is shaping the way that they look at themselves and the way that they look at other things. So my next topic that I want to talk about, now that we've discussed how drugs affect the brain and how somebody can become addicted to them, now it's time to discuss why there are problems with diagnosing, problems with helping the older adults because of their addiction issues, and problems with substance abuse in general with older adults. So one of the main problems is that healthcare is trying to catch up with the amount of people that need healthcare, if that makes any sense. Basically, that there's a shortage of professionals within the field of healthcare, and that makes it extremely difficult to keep on top of everybody. And so, because there's faster appointment rates, and many people have this misconception that the elderly just do not participate in drug activity because statistically it's shown that they don't, but it's not true. Many elderly or many older adults, 65 and older, drink very heavily or use tobacco products, and some of them even dip into illicit drugs use, marijuana, heroin, crack, cocaine. Excuse me. And some of them also use prescription painkillers, and that they've been using their whole entire life. And PCPs, or primary care physicians, have failed to recognize this, and so they don't screen for these types of problems, and so it goes underneath the table. Couple that with the fact that the baby boomer generation comes from a different type of generation where they're ashamed of these illicit drug use, or they're ashamed of the fact that they're using these drugs. You can see now why it's difficult for the PCP to know that they're addicted, or for the patient to explain that they're having a problem with these drugs. Let me just give a couple of statistics here. So alcohol remains the most commonly used substance among older adults. Therefore, the research is more abundant. And I quote, "Among the population at large, older adults reduce their alcohol use as they age. As of 2002, among individuals aged 65 and older in general population, the estimated prevalence is 1.2%. Although these rates are lower than those for young adults, they are likely impacted by the underreporting of heavy drinking, difficulties with differential diagnosis of of problems in older adults and unidentified comorbidities. At-risk drinking, and I quote, is more prevalent among older adults and is likely responsible for a larger share of the harm to the health and well-being of older adults. So what this is basically saying is that high levels of drinking are underreported very often, which skew data, and it's very detrimental to older generations or older people. For example, excuse me. So, for example, in terms of people that drink heavily, in a study of community-based older adults who reported drinking one or more drinks in the previous 3 months, 67% reported binge drinking in the last year. So 67% of that older population that say that they drink have participated in binge drinking, which is still technically considered addictive behavior or addictive problems. Tobacco use is very prevalent. About 14% of those age 65 and older report tobacco use. Illicit drug use has doubled since 2002 to 2012. Excuse me. Prescription, non-prescription, over-the-counter medication use has gotten higher. And I quote, a cross-sectional community-based study of 3,005 individuals aged 57 to 85 years found that 37.1% of men and 36% women used in at least 5 prescription medications concurrently. And that's called multi-pharmacy, where most of the time it happens in older adults. They're on many different prescriptions, and one pill tries to stop another pill, and another pill tries to stop another pill, and the effects of another pill, and so it becomes a very big problem because they then are addicted to many different drugs, and so it becomes extremely difficult. So after talking about some of these things, then the next thing that I would like to talk about is maybe some ways that could be used to combat this problem. So in one of the articles that I found titled Substance Abuse Treatment for Older Adults in Private Centers, they discussed some of the shortcomings and some of the pros and cons that would happen with private healthcare, and they made the exact same statistics that I said earlier, just a little bit different numbers. The number of older adults is estimated to grow from 40 million in 2010, 55 million in 2020, so it's estimated to move up quite a bit. Healthcare is having a hard time keeping up with that. There's an increased example of use of alcohol and late onset dependency problems with alcohol and addiction. What is the difficult part is, and I quote from this article, there are no published studies to our knowledge on the adoption of suggested treatment practices and other expert recommendations for substance abuse disorder treatment techniques useful for older adults. An expert panel commissioned by this is SAMHSA. I tried to find the acronym, but I could not find it. Offers specific substance abuse disorder treatment approaches with older adults. And there's evidence that age-specific programs are linked to better treatment outcomes and adherence in older adults. So what this is saying is that specific treatments for older adults, because they are in a different place and they're generationally different than younger adults, is more effective than just trying to do a cookie-cutter treatment for all adults. And in conclusion, there are many different factors for drug abuse. There are many different factors for the elderly and how vulnerable they are to drug abuse because of problems with healthcare, because of their type of generational thinking, which I'm not placing the blame on them, just how they were raised, and because of the problems that are associated with the elderly, including the fact that sometimes elderly that are on drugs, it can mimic degenerative diseases. It makes it extremely difficult for those to diagnose and treat them. And it's something that we have to do as a society to prop up our healthcare system and to start focusing on this more and more. Thank you very much.